So you're wondering about the prostate check for cancer? Well, in this video, we will show you why that examination is highly unreliable and exposes most men only to scare tactics, false promises, and health dangers. Stick around and be informed. Welcome to HEALTHdrum. I'm Dr. Bert Vorstman, and this channel is all about routine medical conditions, self-care, and cash pay healthcare options, so you can be informed and in control of your healthcare needs. If this is your first time here and you want to learn about routine medical conditions, subscribe below and tap the bell. We get contacted by patients, employers, and physicians regularly looking for ways to ease their healthcare burdens. So feel free to reach out, send us an email, or hit the comment section below. So let's get into it. Here's what we're going to discuss about the prostate check. By the way, this check is also called a digital rectal examination, a prostate touch, or finger wave. So what is the prostate? What is the function of the prostate? Where is it located? How is the prostate check done? And what are the downstream results of this examination? I will include the relevant links to the material in this video in the description below. But before we get into it, we have to go over the disclaimer. The information provided by HEALTHdrum is for educational and informational purposes only and is not a substitute for professional medical advice. You can pause the video and read the disclaimer so you fully understand it. So let's move on. The prostate is a gland which sits at the base of the bladder in men. Let's talk about its function. The prostate produces the ejaculate, and the ejaculate contains enzymes and sperm. The sperms reach the ejaculate from the testicles, and the prostatic enzymes liquefy the ejaculate and mucus. So the main function of the prostate is to produce enzymes that help liquefy the ejaculate and the mucus over the cervix to enable sperms to travel up the uterus and reach the egg. So where is the prostate located? I've included a sketch so you can see exactly where the prostate gland is situated. In the sketch, you can easily see the relationship of the prostate to the bladder and the rectum. Note that the urinary channel passes through the middle of the prostate. So why do physicians want to check the prostate? Because some cancers can feel firm or hard, and by checking the prostate, this may lead to early detection of these cancers. The prostate check is done by a practitioner using a gloved and lubricated finger to enter the anus and feel the texture of the prostate through the rectal wall. The examination can be done standing up and bending over, or lying on one side with legs drawn up. Although the examination takes only but a moment, it can be uncomfortable or even painful in those who have an anal fissure, hemorrhoids, or some anal stenosis after previous hemorrhoid surgery. Also, urinary symptoms are not associated with early prostate cancer. Instead, the urinary symptoms are due to the benign enlargement of the prostate and not the possible cancer within. So let's look at some concerns about the reliability of this prostate check. The prostate check is very unreliable because different physicians will judge the feel of the prostate differently. Also, the cancer needs to be a certain size before it's detectable, and if it's deep within the prostate, will need to be quite big before it can be felt. As well, not all cancers form nodules. And there are two other major concerns. The first is that most nodules are not cancerous and due to benign enlargement, granulomatous prostatitis, TB, or prostatic calculi or stones. Second, a suspicious feeling prostate almost always leads men to prostate needle biopsies, more risks, and more health dangers. So in this video, we learned all about the prostate check and why this examination is highly unreliable. To learn more about routine medical conditions, self-care, and cash pay healthcare options, check out these other videos.